Good evening and thank you for joining us for this evening's discussion. I'm your host, Nicole Hayles. On March 10, the Ministry of Health and Wellness confirmed the first case of COVID-19 in Jamaica, a female patient who arrived from the United Kingdom on March 4. As the numbers climbed, the government implemented numerous safety protocols under the Risk Management Act in an effort to slow the spread of the virus. Two such protocols are the wearing of masks and the practice of social distancing. Tonight, we'll continue to examine and explain the findings from a poll conducted by pollster Bill Johnson. Also joining the discussion is political commentator Linton Gordon and Director of Health Promotion and Education in the Ministry of Health and Wellness, Takis Foga. Ladies and gentlemen, good evening and thank you for joining me.
Good evening.
Thank you so much for having me.
Good evening, everyone.
Good evening.
When the public is asked how worried they are about the COVID-19 pandemic in Jamaica, a little over 50% said they are really not worried. Mr. Johnson, give us a more detailed breakdown of the exact numbers based on the findings.
Certainly, a total of 45% said they were either very worried or somewhat worried. That was 20% who said very worried, 25% somewhat worried. But we found very significant differences between men and women. 51% of women said they were worried compared to 40% of the men. And there were also very, very significant differences by age. Those 18 to 24, the so-called Z generation, 38% said they were worried. And that slowly goes up to age 65 and older, where 57% said they were worried. Now, the good news is that there were no differences politically based on past vote in terms of how worried people were. But as I say, it does vary by gender and by age significantly.
Let's delve a bit more into the differences in the responses based on gender. What were some of the responses that the female gave as opposed to the ones that men gave?
Well, as I mentioned, 51% of the women said they were worried. 48% of the women said they were not worried. And compared to the men, 40% of the men said they were worried, and 59% of the men said they were not worried. So there is a definite statistical difference there in terms of worriness.
Okay, so with the different age groups, you will find that they would respond differently. What are those numbers showing based on the age cohort?
Yes, as I mentioned, those 18 to 24, 38% said they were worried, and it goes up, very slowly goes up till you reach 65 and older, when 57% said they were worried. So it goes from 38 to 57%, from 18 to 65 and above.
Ms. Foga, you're hearing the numbers based on the age cohort. What's the Ministry of Health and Wellness's response to this?
Well, we have been seeking to educate and to empower in various ways as we do different polls, and we thank certainly your poster there for sharing that information, because the more information we get, it helps to guide our intervention. So we have been we have been more seeing persons, well, anecdotally, seemingly not so worried anymore. That is certainly the impression that is given when we, go about doing our different interventions. So it's interesting to get that information, but what it will do is to help us to be a little bit more targeted in messages that we send forth.
Still on the issue of age, those persons 65 years and over still have limited movement. There have been issues of, some pushback from that age cohort, because they're saying the number of days and the hours that they're given to conduct their business isn't enough. What's the Ministry of Health approach as it pertains to this age cohort?
All right, so, well, first I should make the differentiation, because we have our Ministry of Health's emergency operation that advises, recommends, but is ultimately guided to by our National Emergency Operations Center for the entire Jamaica, led by the Prime Minister. And so there are measures that is put in place at that level that speaks to the issues and concerns that are raised. From our perspective on a parish level community intervention, we continue to collaborate with organizations that we know work closely with our senior citizens, like the National Council of Senior Citizens. And the aim is really to empower, to help them to understand the reasons why we would want to have them stay in a little, the fact that they are at risk, and at the same time try to get through the association some of the concerns that together with other ministries we can help in any way. So where there are issues that, there may be challenges in coming out and getting certain things, I do know that together with some service organizations or assistance somewhere, help is given where it can, and again through the National Council of Senior Citizens Association. But readily the measures that have been taken to keep them in has really been because we know the risk that are involved, the fact that they are susceptible to complications, if especially those with underlying illnesses, which quite a high percentage of that age group does have. So we continue to emphasize it, but we do work with other organizations to try to address other concerns that may arise.
Okay, thank you very much, Ms. Foga. Mr. Gordon, I want to bring you in right here. Based on Mr. Johnson's findings, a high percentage were women who expressed fear of the COVID-19 virus. A high amount of our households are headed by women. From a social perspective, how do you see COVID-19 affecting the family?
Well, I am not surprised at the findings of Mr. Johnson, because women are inclined to be more cautious, less adventurous, and more careful. Secondly, there is a feeling going around in Jamaica that the consumption of alcohol is somehow assisting in keeping away the infection, which is not so, but I think that there's that feeling, and men have been gathering, consuming liquor with the hope and expectation that it will help. I don't think it will. But I think we need to look generally at what has happened since March. When the COVID-19 landed in Jamaica, there was widespread fear. By the time we got to April, some businesses were closed, fully closed. Several persons were laid off because there was a lack of understanding and widespread fear as to how easily you could become infected and how widespread the disease was throughout Jamaica. I think we have come over those hurdles to a significant extent. There's a bit better understanding of the disease, and the rate of recovery is fairly high. The rate of mortality is very low, and put those two together, there is a lesser fear in the society today of the disease as it was before. And I think that the gap between the lower age group feeling safer or less threatened than those advanced in age, as Bill and I are, is not surprising because of the increased information and better understanding and improvement in treatment of persons who are affected.
Thank you very much, Mr. Gordon. Now, limiting face-to-face contact with others is said to be the best way to reduce the spread of coronavirus. To practice social or physical distancing, one should stay at least 6 feet or about 2 arms length away from other people. Mr. Johnson, what are persons saying regarding the practice of social distancing?
Okay, basically 45% say they always practice social distancing. 50% say they sometimes practice it, and 5% say they don't practice it. Now, there are very, very significant differences here. If you go by region, in the Kingston, St. Andrew area, 54% say they always practice it. Portmore, Spanish Town, 61%, Mo Bay, 48%, and the rest of the country, 37%. In terms of men and women, once again, there's a gender difference. 48% of women practice it, say they always practice it. 42% of men say they always practice it. And we have our age difference again. Those under 35, 40% say they always practice it. And that rises up until 65 and older, where 63% say they always practice it. But I think one of the things that, if nothing else, came out of the survey is that there seems to be a potential for some problems in the Mo Bay area, just given the relatively lower percentage of people always practicing social distancing.
So we went on the streets to get the views of Jamaicans about the practice of social distancing. This is what they had to say.
It was the panic and everything in the beginning had everybody really worried, but no. I guess it's died down. And the indications from like the airport opening and everything. I guess people know how to handle it better now because we know what to do. And the signs and everything, so yeah, not really worried anymore. Still worried, but not very worried.
We used to be very concerned, very worried about the whole pandemic thing. And after listening to the news, hear the Prime Minister talk over and over, we realized that there's no cure for it. And we have to just live with it like a normal life. So we still have to protect ourselves, same way, hand sanitizer, face mask.
I'm not worried. I'm just worried about my soul. I don't worry about these things because the Bible speaks about these things. So I'm not worried.
I'm not really worried, you know. I wouldn't say I'm worried, but a bit of concerns about how we go forward from here when this is all over. Nobody's know when it's going to be over. But I wouldn't say I'm worried because I follow the protocols, I follow the Ministry of Health, and I do the necessary things, sanitization and anything. And I really don't go on the road unless I have something to do, which is necessary, food items and stuff like that.
I'm not worried. I think them doing a good job in terms of controlling it. The only concern we have is that the citizens have to understand how serious it is and respect what the Minister of Health, this instruction that they give us, follow them, and then everything will be good.
Ms. Fogel, what's the importance of practicing social distancing, and how does this help to reduce the spread of coronavirus?
Okay, so the spread of coronavirus is through the droplets that come from talking, laughter, coughing, sneezing of a person that is infected. And even if we watch ourselves when we speak, there are times when we see, spit that will come out, and there are droplets in those, and it goes a distance. So out of an abundance of caution, the amount of space that was given was 6 feet. I believe you will have differences in how far persons think, but generally it would be said to be between 3 feet to 6 feet is a possibility, with 6 feet really being more out of caution. And so the distancing comes about from the fact that it's not just about being distant from somebody who is coughing or sneezing, but because a person can be asymptomatic, I can have it here and not know, and seem perfectly fine. So the idea right now is that we try to contain, prevent spread by keeping that distance, so that even if someone were to have it and spoke and stuff, it would not impact. But at the same time, when you asked me about distance, and I was going on to speak to mask, but I'll wait till you reach the mask question. But this is the essence of why we should really keep our distance.
Ms. Boga, as a technocrat within the Ministry of Health and Wellness, you would have heard the responses based on the Vox Pop. How would you assess the ministry's efforts so far in ensuring that the public adheres to the general social distancing practices?
Wow. I would say that we have certainly tried in many ways to speak to it, whether through releases, through ads, and we actually have more ads coming up that speak specifically to the physical distance. So sorry about that.
Mr. Gordon, we now have 707 cases of COVID-19 here in Jamaica. 192 of them are reported as imported. The United States, they're reporting over 125,000 deaths, and in the state of Florida, over 10,000 new cases have been reported in a single day. With Jamaica reopening its borders to foreigners on June 15, how satisfied are you with the safety protocols that the government has been implemented so far?
I think it is highly risky. The European Union has taken a position that they will not be allowing Americans from certain states to visit them because of the level of infection in those states. We are likely to have a significant number of tourists coming in from Florida. Whatever we put in place may mitigate, but I don't think it will ensure that there's not an increase in the level of infection being imported by having those visitors here. Secondly, the onus being placed on hotels to ensure that visitors stay in certain areas and don't go to other areas. It's not going to work. There's no system of enforcement in any hotel, and there's no system of preventing a guest from going out. What do you do if a guest is leaving the hotel? Are you going to detain the person? I don't think there is any such power, and I don't think we are going to be able to manage these visitors as we ought to. And it might be better to look at the option of being very selective in the persons we allow to visit as tourists during this time.
To wear or not to wear a mask? That's the question many are asking when it comes to face masks in public places. Those against them say they irritate their skin and make breathing difficult. Others say it's an important way to help reduce the coronavirus. Based on your findings, Mr. Johnson, are the people of Jamaica willing to always wear a mask, or they will wear sometimes or not at all?
Okay, well, basically 36% say they always wear a mask, 56% say they sometimes wear one, 7% say they just don't wear them at all, and 1% don't know. Now, once again, there are very significant differences by region. In the Kingston, St. Andrew area, 48% say they always wear a mask. In the Portmore, Spanish Town area, 41% say they always wear a mask. However, in Mo Bay, this number drops to 31%, and for the rest of the island, it also drops to 31%. Once again, there are significant differences between men and women. 40% of the women say they always wear a mask. 32% of the men say they always wear a mask. And of course, we also have an age difference here. 28% of those 18 to 24 say they always wear a mask. and that increases up to age 65 and older, where 58% say they always wear a mask. I should add that these numbers are significantly better than numbers in the United States and a lot of other countries, but there's still a lot of work to be done.
Okay, thank you, Mr. Johnson. Before we wrap up today's discussion, Ms. Foga, any final words? Oh, it seems we have lost Ms. Foga, and we're trying to resume our connection with her. Mr. Gordon, your comments before we wrap up?
Yes, I'm pleased to hear that the numbers, though not at the level they should be, are fairly high. The number of persons wearing masks. We have to convince the rest of the population of the importance of this practice. I have observed in several businesses that it is enforced strictly and persons are turned back from the entrance where they are not so properly fitted with a mask. So I hope that we can increase and improve on this, and we will rely on the Ministry of Health to educate the public more and ensure that it is widespread, accepted, and practiced by the vast majority, if not all of us.
Okay, thank you very much, Mr. Gordon. And that's it for our discussion for this evening, where we were looking at the wearing of masks and social distancing. We had with us this evening pollster Bill Johnson, as well as political commentator Linton Gordon, and we also had Director for Health Promotion and Education in the Ministry of Health and Wellness, Takis Foga. That's our program for this evening. I'm Nicole Hayles. Thanks for joining us.